you can reverse diabetes. You do it almost all the time, every day. Can you tell us about that?
Yes, most of our type 2 diabetic patients who come into the retreat or follow my program get rid of their diabetes quickly, very quickly. Sometimes so quickly they got to get off their medications really fast because their sugars get too low.
That's what you monitor, I feel like, really closely for retreat guys.
Yes, yeah, we have to get them off their insulin and off their diabetic medications. By the way, you have a person whose beta cells are overworked from their diets and their body weight straining the production of insulin. And now you take diabetic drugs, which are forcing the beta cells in the pancreas to produce more insulin, so you can get the sugar down. And that poops out the insulin production of the beta cells even faster, which makes the diabetes more advanced and more serious. So going to doctors and taking drugs for diabetes, or taking more insulin. The insulin is the problem, having too much insulin as it is. Adding more insulin to control your sugar makes you gain weight more. You gain more weight, you're more diabetic. So the Accord study was a study which took people with diabetes and split them into two groups. And one group got more medical care, more doctor visits, more finger stick to check their sugars all the time. And the other group just left them alone, let them sugars run less high and more sloppily cared for. And the government, after 8 years, came in and had to stop the study because they found so many more people were developing serious problems and more death in the group getting more medical care. And it showed that more drugs with diabetes meant for more death because more trying to keep the sugars lower with more drugs was worse than letting the sugars run higher. Now, I'm not saying let the sugars run higher. I'm not saying use drugs to put it down either.
You're saying change your diet.
Change your life and your exercise. Exercise, change your diet, eat right. And my mantra here is don't control your diabetes. Get rid of it. Don't get it numbers better. Don't manage it. Become non-diabetic. And
100%.
So do what you need to do. So we actually put together a program where people are eating vegetables and beans and nuts and seeds and mushrooms and onions, and they're eating and only intact grains, and their diabetes goes away, and they get satisfied with fewer calories now because we're taking away their addictive drive to overeat and all the extra insulin they were producing, which drives their overeating behavior. So they're satisfied with less calories now.
Which I want to say something about that, less calories, because it's so funny to me when you look at like a small McDonald's burger, like you can look at something and say it's 500-600 calories on a standard American diet, and it looks like no food. A tiny bit of pasta, a tiny bit of cheese, a tiny bit of meat. But less calories on a Nutritarian diet actually looks like a surprising amount of food, I think, for a lot of people. It's never not a good portion. And I think you don't have to eat like a bird for it to be less calories. It's just the wiser choices of foods that are less calories.
Right. That's why conventional dieting doesn't work, because people try to cut back on the amount of food and they're not satisfied with that small amount of food. You need a certain volume, you need a certain amount of fiber, you need a certain weight in your stomach. You need to feel like you ate a meal. And by try to cut back on calories, eat thimble-sized portions of food. It will never sustain a person long term.
I love the volume. I actually love my food. I'm a good eater. But yes, it's the right food.
But people get so habituated to overeating, and they get so habituated to eating foods that stimulate the brain that it's very difficult for them to imagine eating this healthfully. That's why people have to just do it. Understand the concept, just do it. And then, of course, we're instructing people to, if you're diabetic, watch your sugar really close when you start the diet, because you'd be amazed at how fast your sugar will go down. And your medications has to be reduced, because if your sugar gets too low, you could pass out or something.
So if you're doing this at home, you definitely should consult your doctor.
You need to work with a doctor.
Oh, totally.
And you need to watch your sugars more closely at the beginning, the first few weeks, not less closely, so your medications could be tapered down, and err on the side of letting your sugars run higher, not trying to medicate them lower. Let them run a little high for a while until you get the feel of getting them down. And I like to tell people, let's do what it takes to get your sugar down. And that means, if you can, go for a walk after every meal. Do 3 walks a day. That's your medication.
I love walking.
Your diet and walking is your medication, or exercise in general. We'd want them to use their body parts, but it's the whole holistic approach.
Totally.
But if the diabetic person is overweight and not losing weight each week, then they're not improving their diabetes, because unless they're losing weight, they're not becoming less diabetic. You have to lose weight to improve insulin sensitivity. So the two terms here, remember, insulin resistance and insulin sensitivity. So we want the insulin receptor to be sensitive to insulin. So only a little bit of insulin is needed. And the only way to do that is to lower body fat.
It makes sense.
So we can measure body fat too.